Hello everyone, this is Sabrine from Solace Asia, the international addiction treatment and retreat situated in Kuala Lumpur, Malaysia. Today I'd like to talk about Solace and its different kind of services offered to the international patient. So I would like to introduce you to the clinical manager and senior therapist of Solace Asia, Niels Klok. Hello.
Hello.
How are you?
Fine, thank you.
Welcome. First of all, I want to know where Solace is.
Solace is a treatment center located in KL where we provide healthcare services to people struggling with addictions.
So actually what happens after the detox in hospital?
After detoxification, people come to Solace. They will be picked up by our staff members and when brought here they go into an intake process where they have to, we fill in some forms, where we ask them some questions, and then mainly what is really important that people get comfortable. Right? We try to aim that that people are in an environment where they feel safe, where they feel helped and understood. So initially, it's mostly important that people are comfortable.
Why people will come here? What's the specialty of this hospital? Can you please elaborate us?
People come in mainly because they're struggling with addiction. And addiction can be many things. We have substance abuse issues, people who are addicted to substances, but also behaviors like gambling or sex. People come here to work on these issues. Our specialty is to help these people in a homely environment, supported by professionals who not only are very well versed in what they do, they also care.
Okay. What kind of room category do you provide to the patients?
We have several different room options for people who want to stay with us. We have a sharing option where you share a room with other people. Okay. We have a double room option where you have only one person you share a room with. And we have a single room option where you have a room all by yourself. Okay. Yeah. So there's different options. Room-wise, the treatment people get is all the same. It doesn't matter if you come in a shared room or a single room, the treatment is the same. Again, like I said earlier, we try to provide that in a homely, comfortable and safe environment. So we are located in a nice area just outside Kuala Lumpur with a big garden, a nice swimming pool, a comfortable place for not only to do therapy, but also to relax.
Do you have any premium services for VVIP or international patients who want special treatment?
Yes, we also have a premium service for people who don't feel comfortable staying in an inpatient treatment center. We offer the option to stay outside. For those people, we arrange accommodation in a hotel or a luxury apartment where they will still have 24/7 support by a coach and a nurse, and during the day they come to our center to follow our treatment program.
Who actually works here?
We have a very diverse group of clinicians. We have social workers, we have experience-based practitioners, we have clinical psychologists, we have a counseling psychologist, and we have a pool of coaches, and that is always supported by a nursing team. So that's the people who always work here, and like I said, there's 24/7 cover. There's always a staff member present at Solace. And to support that, we have a yoga instructor, we have an art therapist, we have a counseling psychiatrist who all support our treatment process.
Okay. Is it only a de-addiction treatment center or you provide other mental health services?
Yes, we primarily focus on addiction. However, we are all trained to cover a wider range of mental health issues. And not only do we look at the individual, we look at where people come from. We look at their families, we look at what addiction has caused. And in our experience is that addiction is never alone. It hurts families, it harms how people operate. So besides our focus on addiction, which is our primary focus, we also look at other things. We have people who are specialized in working with psychiatric disorders like personality disorders, mood disorders.
Borderline personality?
Yeah, borderline personality disorder is one of those things. So Yeah, to recap, we focus mainly on addiction, but we understand that addiction often comes with other issues.
Okay. For a drug addicted people, how long it will take time to recover actually?
Yeah, that's a really good question. How long does it take to recover? And that's impossible to answer. And I say that because we have the aim to support people to the end, right? To the end of their process. However, we understand that recovering from addiction is not easy. It is something that takes a lot of time, a lot of effort from not just the person who's struggling with addiction, but everybody in his or her network. Like our treatment program initially focused on 28 days, but how long people need, it's kind of like asking, how long does it take to recover from any illness? We need to look at what the person needs, and we support that. We tailor-make our program around that person, and we do our utmost best to help people move through that. Our treatment program offers a 28-day stay, but often clients, after experiencing how we work and what we do, decide to stay a bit longer. What we suggest initially is to stay about 3 months.
So please tell me in a brief way, what's your aim of Solace?
Our aim is to provide world-class healthcare in a homely environment. Okay. We understand that people struggling with addiction or other mental health issues have the need to feel safe, the need to feel understood, and we provide that here. And we do that through offering treatment modalities that have been proven, scientifically proven, with a mixture of spiritual support. And that can be religious, but that can also be spiritual in other means.
Okay. So yeah, thanks for your time. It's great to know what Solace has to offer, and hopefully people watching over there have a better understanding of the services you provide. Thank you.
Thank you.
So thanks for watching, and thanks for staying with us. Stay connected with Solace. Thank you.